Knee mechanics, including knee alignment, is a critical component missing to most treatment programs for knee pain. Poor knee alignment is a common problem in knee pain conditions and can be the initial cause of knee pain or perpetuate many knee pain conditions. Whether a knee condition is acute or chronic, knee alignment should not be ignored. Alignment should be radiographically measured when poor knee alignment is suspected and compared with age-adjusted reference ranges because knee alignment changes during growth, especially due to the fact that the goal for most knee treatment programs is returning to weight-bearing activities. Poor knee alignment has effects similar to bad tire alignment on a car. It causes the knee to wear prematurely. Though knee alignment problems have more significant effects compared to tire alignment problems, because they involve the orientation of two surfaces. In this example, there would be effects of both poor tire alignment and poor road alignment. The knee is a complex structure comprised of numerous bones, cartilage, ligaments, tendons, and muscles. Most people tend to focus on the cartilage and ligament structures in knee problems. However, these other structures should be properly assessed and addressed when appropriate. Poor knee alignment can potentially affect all of these structures or the entire joint, not just the cartilage. Although meniscus or knee cartilage is not visible on this radiograph, the amount of space for the knee cartilage is. Obviously, there is little to no space for the cartilage cushion on the outside of the joint of this right knee, especially when compared to the other side. Not so obvious, though, are the changes in the surrounding structures. The ligaments and edges of the joint surfaces have become denser with calcium and larger. It is as if the joint surfaces of this knee are being extended, like a balcony. This is even more evident when we compare it to the outside of the other knee. There are also changes in the inside of the bones. If we divide up the inside and outside of the bones, we can see density changes between the two. The side bearing the weight is increased in density, and the other side appears less dense and osteoporotic. When bones become denser and harder, they flex less and do not absorb jarring motions or impacts as well. When subject to jarring motions, harder bones transmit energy from impacts more to the rest of the body than normal bone. Thus, poor knee alignment can potentially affect the whole joint. A study was recently published in the Annals of Rheumatic Diseases that surgically mounted an external frame that provided constant knee joint distraction for 2 months in a group of 20 patients. Tissue modification and pain reduction was observed and significant even after 3 years of removing the device. Representative radiographs before and 3 years after distraction show a clear increase in the joint space width in the affected osteoarthritic compartment, labeled OA. In addition, the affected osteoarthritic compartment showed a decrease in subchondral bone density. Interestingly, minimum joint space width continuously increased after the distraction frame was removed for 10 months. Now that we understand the problem better, what is the best solution? Although the external frame that provides constant distraction seems promising, it must be surgically mounted and requires larger and longer studies before being recommended. However, the knee's potential to heal, given the correct conditions, has been demonstrated. Thus, the concept can be used to fashion a new paradigm of conservative treatment. Common treatments recommended by doctors today for knee pain are topical rubs, glucosamine sulfate, Tylenol, NSAIDs or non-steroidal anti-inflammatory drugs, muscle relaxants, injected corticosteroids, injected hyaluronins, DMARDs or disease-modifying antirheumatic drugs, and total knee replacement surgery. Although significantly effective for reducing symptoms, most of these treatments do not address or correct poor knee alignment. The treatment that does, total knee replacement, is rather invasive. The best solutions for knee conditions with poor knee alignment begin with reducing the load on the affected areas. More severe or acute conditions may benefit from reduced weight-bearing exercises, such as aquatic walking or low-resistance cycling, in order to allow the whole joint a better environment to heal. These reduced weight-bearing exercises can promote movement, circulation, and muscle development that better supports proper knee alignment without further damaging the joint. Next, a foot arch assessment can ensure an adequate foundation for the knee. A collapsed or fallen foot arch can contribute to poor knee alignment and increased focal loading of the knee. If a foot arch has collapsed or fallen, supporting the arch with a full contact orthotic can be an effective technique to reduce the load on the knee. Another method for reducing the load on a knee with poor alignment is an unloader brace. Unloader braces come in a wide variety of sizes, materials, and colors. An unloader brace applies pressure to the knee in order to realign it. Some knees need to be moved inward and some outward. In addition, if certain muscles, tendons, and ligaments are stretched, damaged, or torn, unloader braces can help compensate for the associated lack of structural integrity. You can see in this before and after X-ray that the knee unloader brace increased the joint space, taking load or pressure off of the affected part of the knee, hence the name unloader brace. If the knee ligaments are severely stretched or torn, the brace may need to be worn permanently to correct alignment. However, it can often be worn for 6 to 12 months to change knee alignment if combined with a comprehensive treatment program. If applicable, weight loss can be an extremely effective means for reducing the load on a knee with poor or regular alignment. Just 5 to 10 pounds of weight loss can make significant improvements in knee pain. Activity modulation can be an additional treatment option as well. If you regularly participate in a jarring or prolonged weight-bearing activity, such as running, jumping, horseback riding, or high-impact aerobics classes, a temporary or permanent lifestyle change may be valuable. Consider substituting higher load-bearing activities with lesser load-bearing activities, such as cycling or swimming. Reduce shock absorption by using flexible orthotics, gel shoe inserts, or shoes with shock-absorbing soles. Or if barefoot running or walking is preferred, decrease shock absorption by changing the firmness of the exercise surface, such as running in soft sand. A recent study published in the New England Journal of Medicine demonstrated that exercise plus manual therapy was as effective as surgery at the 1-year mark in people with early knee osteoarthritis. Collectively, evidence suggests that once alignment and mechanical stress has been optimized, a trial of specific supplements or medications aimed at reducing inflammation, increasing cartilage volume, or reducing the rate of damage to bone and cartilage would be more efficiently employed. The 5 steps to filling in the missing piece to your knee treatment program are: first, obtain a weight-bearing or standing X-ray to check your knee alignment. Second, consider non-weight-bearing exercises for acute or severe conditions. Third, realign knee if necessary with arch corrective foot orthotics or a knee unloader brace. Fourth, reduce the mechanical load on your knees with weight loss, avoiding jarring activities, incorporating less loading activities, and reducing shock absorption. Fifth, perform exercises that help support knee function regularly and in proper alignment. The missing piece summary is treat the knee joint as a whole, not just parts of it. Joint problems are more than cartilage problems, and addressing the mechanical aspects of knee joint problems improves pain outcomes. For a comprehensive knee assessment and treatment plan that includes knee alignment and mechanical aspects, visit one of our Haggard Chiropractic locations where innovative technologies are guided by tradition and trust.